famous for its flamingos, now boasts of best practices in healthcare management and delivery. Its mandate to provide quality, affordable healthcare is spearheaded by the county's Executive Member for Health, Dr. Kabi Mungai.
We have 419 facilities. That is in form of Tier 1, Tier 2, Tier 3. Tier 1 and Tier 2 are primary healthcare facilities. Tier 3 are sub-county hospitals, and we have one major referral county hospital, that is Nakuru Provincial General. They call it Nakuru PGH, but now it's been renamed to the Nakuru County Referral Hospital.
For Nakuru County, devolution has been the clarion call to get down to work. With a vast infrastructure spanning over 400 health facilities comprising of public, private, NGO and faith-based healthcare centers, devolution handed a lifeline in some of the county's facilities. A case in point is the effort by the county's Ministry of Health to fast-track the completion of the Mirugi Karaoke Health Center, which was recently unveiled by the Deputy President.
Our county government has really helped us a lot. I take an example of our facility. In fact, this facility the construction of the inpatient and maternity was started way back in 2010. It is stalled for some time, almost 3 years, and now once the county government has been in place, it has seen the completion of the maternity, whereby now our clients will be comfortable getting services from within.
The public health sector has often been plagued by inadequate supply of drugs and other hospital essentials. Not so for Nakuru County since devolution of a health function. Many facilities are reporting adequate supplies and prompt response by the county when stocks run short.
For where I currently work, it's also working out. We go into a budgeting cycle. We allocate, let's say, R1 million into medicines. And while we are waiting to spend that money, we receive R1 million worth of the same drugs. So that means that money can go and get more. So we can now go and get the much more exotic drugs that we do not afford.
We had so much problems of drug stockouts. Right now we don't have such, it's not as much. Though sometimes they are going out of stock, but not as much as we used to do. They are taking care of our supplies quite well.
When we don't have enough drugs, it goes out of stock, we call the county, they help us sort that issue.
County's goal is to provide accessible, affordable and available healthcare services to its residents. Each sub-county is projected to have its own fully equipped hospital with adequate staff in an effort to bring health services closer to the people and reduce the burden of its major referral center, Rift Valley PGH. This has already been started with remodeling of facilities that were literally on their knees prior to devolution.
We are working on a memorandum of understanding between Egerton University and Nakuru County Referral Hospital, because I was in the University of Nairobi and consultants will have a call. They'll do ward rounds, they'll go to theatre and operate on the same patients. So now we want to come up with a thorough memorandum of understanding.
The county's efforts towards achieving the healthcare goals for its citizens has been met with challenges. The quick transition to a devolved healthcare system has not been easy to manage. As with other counties, Nakuru was ill-prepared to take over health in its totality as a local function, and particularly the sagging wage burden of healthcare workers.
WHO recommendation says 1 nurse to 6 patients, yeah? At least 1 doctor to 500. But when you go to our wards, that is the opposite. You can have 1 nurse running a whole maternity, 2 nurses, and they have like 100 patients inside.
Despite the initial challenges of devolution, the future of the health of Nakuru County residents can only look brighter for now, with a progressive health administration that is determined to take quality services to the Mwananchi's doorstep. Not just any service, but quality, affordable, accessible and available services.
Our goal is to make sure that the healthcare in Nakuru County will be accessible, available and affordable.
With these efforts by the county administration, Nakuru County will not only be famous for its flamingos, but also its top-notch healthcare system and management that will be a model to other counties.
The county government is really working hard for this, for the community.
Karibuni Nairobi, the maternity will be open soon.
All you need to do is try and get services in any government facility.
We will make sure that every personnel is trained adequately to offer all the kind of basic services that is required as per the level of the health facility.